Hi, let's talk about the arteries of the neck. So in this video, we're going to discuss the location and distribution patterns of the major arteries of the neck. So the arteries of the neck are all being sourced from the arch of the aorta. So the ascending aorta leaves the left ventricle and it feeds directly into the arch of the aorta before becoming the descending aorta. The arch of the aorta has three major branches. The first branch is the brachiocephalic trunk, and then we have the left common carotid artery, and then the left subclavian artery. That brachiocephalic trunk is going to bifurcate into the right subclavian artery and a right common carotid artery. So for each side of the body, there's both a subclavian artery and a common carotid artery. That subclavian artery is going to be the principal blood supply to the upper limb, inclusive of the shoulder. It's also going to have several major branches to serve both the head and neck, as well as branches that serve the thorax. The common carotid artery is going to be a major constituent of the carotid sheath. It's going to ascend the neck through the carotid sheath in a anteromedial aspect of the sheath. And towards the superior aspect of the neck, it's going to ramify into two branches, an internal carotid artery and an external carotid artery. That internal carotid artery has no branches to serve the neck. It's going to ascend the neck, and it's going to enter into the skull through the carotid canal, and it's going to be one of two major principal blood supplies to the cranial cavity and brain, the other being the vertebral artery. The external carotid artery, on the other hand, will have several branches to serve the neck, face, and head, as we'll see. So let's take a look at that common carotid artery. So I can see, let's point out a few things. There is ansa cervicalis. There are branches to the strap muscles. And ansa, as you may recall, rests upon and sometimes is embedded within the carotid sheath. I can see the internal jugular vein, more anterolateral, and here is the common carotid artery, and it's beginning to bifurcate. We can see that bifurcation there. So the external carotid artery takes more of an anterior position, and the internal carotid artery takes more of a posterior position, and that's going to ascend into the cranial cavity. It will have branches that leave the cranial cavity to serve portions of the face and scalp, but we'll discuss the granular details of that in a subsequent session. We can see one of the earliest branches of the external carotid here. This is the superior thyroid artery, which is going to serve both the thyroid and give a branch to the larynx called the superior laryngeal artery. The external carotid artery has several major branches, and I don't want you to get wrapped up in too many of the details here, but let's give you a big picture view of what this artery is doing for us. So the first branch is the superior thyroid artery. That superior thyroid artery is supplying the thyroid gland. It's supplying muscles of the anterior neck, like the infrahyoids, as well as portions of the distal sternocleidomastoid. Then we have a lingual artery. The lingual artery is heading toward the tongue, and it's going to have several branches serving features of the oral cavity. There's a facial artery, which will be more prominent in next week's lab. the facial artery is going to traverse this submandibular space, and it's going to pop over this premasseteric notch. There's the masseter there. And there's a little notch there where the facial artery comes across from that submandibular triangle onto the face. The next branch that we have is the ascending pharyngeal, which is going to go deep and serve muscles of the pharynx, in particular the middle and inferior pharyngeal constrictors, as well as some of the longitudinal muscles. We also have an occipital artery. That occipital artery is going to serve some of the proximal portions of the sternocleidomastoid muscle, as well as the posterior aspect of the head and scalp. There's a posterior auricular artery. So there's the external acoustic meatus. So as you can imagine, the ear is round about here. That posterior auricular artery is going to serve some of the superficial muscles of the scalp, some of the auricular muscles, as well as the scalp and the skin posterior to the ear. And then we have two of the terminal branches of the external carotid artery, and one of these is going to be quite the star of a subsequent session. The maxillary artery. The maxillary artery is going to dive deep posterior to the mandible there, and it's going to be the principal blood supply to the deep face and infratemporal fossa. And then there's the superficial temporal artery. That superficial temporal artery is going to supply the face, the head, and scalp with blood. So there's quite a bit of external carotid branches servicing different parts of the head and neck here. Now let's take a look at the subclavian artery. So just to orient you, I'll outline, there's the brachiocephalic trunk. There is the common carotid artery ascending the sheath. There's the vagus nerve coming down there, so that's cranial nerve 10. And then there's the subclavian artery. Now, the subclavian artery has three major parts to it, and those parts are defined by their relationship to this muscle here, the anterior scalene muscle. The anterior scalene muscle is the key to the root of the neck. So anything medial to the anterior scalene muscle is the first part of the subclavian artery. Anything posterior to the anterior scalene muscle is of the second part of the subclavian artery. And anything lateral, L here, to the anterior scalene muscle out to the lateral margin of rib 1, that's what this lovely feature is here, is the third part of the subclavian artery. Anything beyond that lateral margin of rib 1 is known as the axillary artery. And the axillary artery is going to continue to the upper limb through the axilla, or colloquially the armpit, to serve the upper limb. Now, each part of the subclavian artery has its different branches, but I want us to especially focus on the branches of the first part of the subclavian artery, because these are some very significant branches in the context of anatomy of the head and neck. So this first branch here is the vertebral artery. The vertebral artery is going to exit the first part of the subclavian artery, and it's going to enter into the transverse foramina of the cervical vertebrae and ascend its way up to the foramen magnum, where it will enter the skull and be the principal blood flow to the posterior aspect of the brain. So the cerebellum, brainstem, posterior cerebrum, diencephalon, things like that. There's also an internal thoracic artery, which is going to descend the thorax, supplying the intercostal spaces. That's the spaces between the ribs, and all of the muscles there with blood, as well as some of the muscles of the abdominal wall, the anterior abdominal wall in particular, a muscle known as rectus abdominis. And then there is a third branch, and this has very many branches, and that's called the thyrocervical trunk. So the thyrocervical trunk, we're going to break down into its constituent branches. So let's take a look at that here. So I'm outlining the trunk there. This first branch is the inferior thyroid artery. The inferior thyroid artery is going to be a blood supply to the thyroid. It's also going to be the principal blood supply to the parathyroid glands, located posterior to the lobes of the thyroid gland. And it's going to give off the inferior laryngeal artery, which will ascend in the tracheoesophageal groove up to the larynx. It will be accompanied by the recurrent laryngeal nerve, as we'll see. Next up, we have this tiny branch that is the ascending cervical artery. The ascending cervical artery supplies some of the deep neck muscles with blood, in particular the scalenes with blood. The next artery is the transverse cervical artery. That transverse cervical artery is the principal blood supply to the trapezius muscle. Sometimes that transverse cervical artery, so about a third of the time, is going to come off of a branch of the third part of the subclavian artery. And then we have the subscapular artery. The subscapular artery is going out to serve the shoulder and some of the rotator cuff muscles. So in particular, the supraspinatus and infraspinatus muscles with blood. And that leads us to the assessment question for this video, and that is the thyroid gland is supplied by the superior and inferior thyroid arteries, which are branches of which two arteries? Be as specific as possible. Well, let's think about this. Superior thyroid is a branch of the external carotid artery. The inferior thyroid artery is a branch of the thyrocervical trunk. And the thyrocervical trunk is a branch of the first part of the subclavian artery. So when we look at these answers, the best fit, let's see, common carotid and subclavian. Kind of, we can get probably a little more specific. External carotid, ding, 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 that's the superior, and internal carotid. No, that's not the right answer. External carotid, yes, we're getting there, and subclavian, yeah, not directly, but kind of. And then internal carotid, no, and subclavian, kind of. So the very best answer here would be C. But ultimately, the very best answer would be the external carotid artery and the thyrocervical trunk. Thank you so much for your time, and I'll see you in the next video.